yesterday at a TV program, it was a serious issue on the issue of the contract between the Ministry of Health and the Lightwave Health Information Management System. The fact that we are now going back to manual system of collecting data, that after an initiative by the previous government to digitalize our data and to contract to ensuring that we have electronic collection of patients' data for the purposes of coordinating and informing health, evidence-based health policies, we are now back to that era. And that's the reason why I want the minister to rather take this issue more importantly now, because the members of parliament are here, the representatives of the people are here. And if he's going to organize press conference somewhere to address them, I'm not sure I'll be at the press conference, and I'm not sure how I'm going to tell the people of Wale Wale how the minister is addressing this issue. Mr. Speaker, the fact is that these people have not been paid their money. What measures is the minister putting in place to pay them their money so that they can bring back their service? Mr. Speaker, this is my question to him.
Thank you. Honorable Minister, he's saying this is the biggest platform you can have. So
Mr. Speaker, I agree. I will take up the challenge.
Yes.
So hear me. Mr. Speaker, in 2019, Ghana government signed an agreement with a company called Lightwave. Mr. Speaker, the contract sum was $100 million to connect 950 health facilities in the whole country. And the contract was supposed to expire in 2022. Mr. Speaker, in 2022, the contract was extended twice to expire on the 31st December 2024. Mr. Speaker, at the end of the 2024, out of the 950 facilities, only 450 had been connected. Out of the $100 million, $77 million had been paid. More than 77%. Meanwhile, less than 50% of the job had been done. Mr. Speaker, as part of the contract, it was supposed to be divided into what we call milestones. And so at the end of each milestone, the infrastructure and everything must be handed over to the states. Mr. Speaker, it is unconscionable for any government appointee to sign an electronic agreement that an individual will be hosting our data and the state will not have access to our data and the state will not have access to our service. Our health data. Mr. Speaker, this is what we inherited. Mr. Speaker, at the end of the 2024 when we took office, in 2025, the contract had expired. And so the issue of the government has come to terminate any contract doesn't arise, Mr. Speaker, because the contract actually expired on 31st December 2024. So there was no issue of termination. Mr. Speaker, when we took office, as part of the contract, we said, hand over whatever you have done to the state. And before we sit to take delivery of whatever has been done, we needed as a ministry, as a government, to know whatever we were inheriting. And so a forensic audit was conducted, Mr. Speaker. Mr. Speaker, as part of the forensic audit, what we realized was that the software, the hardware, the infrastructure alone, there were gaps. For example, it was stated in the agreement that supply HP laptops. You go to the facilities and a different brand has been supplied. Supply 20 and you go to the grounds and less than 20 has been supplied. So there were issues of quality and there were issues of quantity. Gaps. Mr. Speaker, the gaps alone, when analyzed, was over $18 million for the hardware. That was the gaps. Mr. Speaker, it will interest you to know that in the next milestone, Ghana government paid more than $10 million to the vendor. And he was supposed to connect about 157 facilities. The Speaker, guess what? Only 7 was verified. 7. 1, 2, 3, 4, 5, 6, 7. Mr. Speaker, after all this, we said that, look, because we don't need any disruptions, we were ready to sign another agreement because there was no agreement, there was no contract. because of the software, Mr. Speaker, it doesn't also make sense for the country's data, the software, to be owned by an individual. So we are ready. Let's sign a license renewal agreement for 2 years. Mr. Speaker, the vendor indicated that in the agreement he doesn't want to hear anything about data. Yes. Mr. Speaker, the vendor again indicated that we should write as part of the contract that we, the ministry, have verified 461 instead of 450. Mr. Speaker, there and then, as ministry, we had to put our heads together to find solution to the matter than lamenting. Mr. Speaker, so, honorable members, the good news is that I've shared with you the challenges we have inherited, where the medical records, the electronic medical records, was being hosted by an individual, where the country didn't have access to our service. But at the moment, Mr. Speaker, we have the solution, and we are rolling out in the whole country. We have a 4-week plan. In the first 1 week, next week, we are rolling more than 100 facilities. The third week, more than 100 facilities. And Mr. Speaker, I can assure you, with the shortest possible time, we'll get all these 450 facilities covered. Mr. Speaker, what this vendor was doing to the state was that as and when he demands what, then you switch the thing off. And Mr. Speaker, for your information, the data, the server doesn't even sit in Ghana. It's far away in India. Yes, far away in India. Mr. Speaker, we are religiously guided by this contract, and we'll put in place the necessary solutions so that we'll prevent the reoccurrence of the mess we have inherited. Mr. Speaker, tomorrow